Hi everyone, it's Dr. Shea from Learn ABA with Dr. Shea, and I'm sorry if things look a little different than usual. I am not in my general setup. I am in New York at a hotel. So I'm still bringing this to you, but apologies if appearances are a little bit different and it's not quite as polished as usual. Alrighty, so our Tuesday tip of the day, I still want to make a better name for this thing, but whatever, it's fine. Our discharge planning / discharge goals, as in how do you know someone is done with therapy? So I jotted down 4 ways that I know someone is done. So the first way that I've got is that natural contingencies actually have taken over for programmed reinforcement. So someone does like taking the shower because they feel cleaner and their skin's not itchy. Or they, I don't know, like saying hi to people because they realize that they have more friends, and that's kind of nice, right? So that's number 1. It's pretty easy, but that natural contingencies really have taken over. And what that really means when you think about it is that people are doing the behavior for its own sake because it benefits them personally. And that is peak social validity, if you ask me. So that's the best way to discharge someone and say you are done with therapy. All right, way number 2 is that functional outcomes have been met. So I've talked about functional outcomes in my writing workshop, but in case any of you haven't taken that, it's a way you would know someone has achieved treatment success without necessarily having any data, which I know sounds like absolute blasphemy for behavior analysts, but like hang with me. So someone could have a functional outcome. You can do it as a thought experiment, which is what I recommend. You're still going to collect data because you have to, and it's the best way to do things, obviously. But a functional outcome is like in your mind, if you had a snapshot of this person in life doing something, you could see them doing that thing and know that they have success, right? Like they're done, they don't need anything else. So if it's eating ice cream out with their sisters and brothers and they can do that every week because they're not having a tantrum or a meltdown or anything like that, where they're having to take everyone home and end the outing early, stuff like that, then that would be kind of a functional outcome, meaning you're doing better. Another example would be, say someone has borderline personality disorder, because I've worked a lot with that. A functional outcome might be that they have a stable relationship that lasts at least 6 months with no more than a 5 out of 10 anxiety on the rating scale about separation, right? So things like that are functional outcomes. If I look at them, they have a family, they're not worried about their husband leaving them, they're happy, they feel secure, I'm good. So that was way number 2 that I identified. Way number 3 is my least favorite way, but I have discharged multiple clients because of it, and that is lack of treatment adherence, as in the client is not taking data, they are not practicing the acquisition programs that you've written for them. The moment you leave, they don't do anything else until when you get there again next week. And that's unethical. So I discharge those guys, and I mean, I try everything first to make sure the data collection is reasonable. I try all different interventions to see which one they might like the most. But at the end of the day, if I try like 10 different things and none of the things are things that they are willing to work on, willing to put any effort into, and I'm the only one putting the effort in, then I will discharge them for lack of treatment adherence, because if I'm a treatment provider seeing them weekly, it looks like they are getting treatment, when in reality, I know they are not receiving treatment. So that's an ethical problem right there. But then also, you don't know what, if anything, your treatment is doing because you don't have data, if they're not taking data and then they're not practicing. And then also, it's not good for behavior analysis as a name, as a community, right? Because say we do this a lot, we never fire anybody as a patient, then you'd have a lot of people saying, oh, ABA just doesn't work. I had someone come out to my house for like 6 months and didn't do anything. It's because they didn't do anything. But we can't do that. I know it's hard to discontinue services with a client, and if you want advice on how to have that conversation, please leave a comment and I will be happy to give you what I've learned over the years, but that's where I go. And last but not least, 4, the best one, and that's why it's not least, is they're independent. You've put yourself out of business, and that is the best way to discharge someone, is that they don't need you anymore. They are independent. They can go to the store. They can have a relationship. They can do whatever it is that they need to do without you. They are on their own and they are golden. And that is my favorite reason to discharge someone. That is discharge for success. And as far as planning, I might do that next week because that's a whole video into itself. If there's anything else you guys want to hear, let me know. And then if you're seeing this on YouTube or whatnot, then don't forget to subscribe and hit like if you want to see more videos like this.